Hello, my name is Dr. Nagrasheth. I'm the Director of Robotic Surgery and Gynecologic Oncology here at Englewood Hospital. Ovarian cancer is a very serious gynecologic cancer. It's a major public health problem. So in certain patients, there are genetic mutations that are involved in the development of ovarian cancer. We know of a link, family link, hereditary link. That's about 15% of patients or so, maybe 10 to 15% of patients, depending on how we look at it, that have a genetic link to ovarian cancer. And in those patients, if we identify that before they actually develop the cancer, we can offer ways to either screen for detecting cancer early, prevention such as taking the birth control pill, which is like a chemopreventative, and also risk reduction surgery, an ability to actually remove the tubes and ovaries before a cancer actually develops. Now, there are risks to surgery, there's risks to considering taking out the ovaries early in a premenopausal state, there's risks of heart disease and osteoporosis when you take out ovaries before menopause, but there's also, again, some potential benefits. So in certain patients, again, with the genetic mutation that we identify, it may be beneficial to do that. Cervical cancer really represents the ideal model for a screening test for cancers in terms of pap smears being that screening test that can detect a precancerous lesion before a cancer develops, and it's usually over a long period of time. So cervical cancer would rarely develop in the course of a couple months of having a early precancerous lesion. Usually it takes years. What we've learned is we have now very good screening tests available for cervical cancer. Now the recommendation is every 3 to 5 years for patients that have had no previous cervical issues and are testing negative for the virus and having normal pap smears. So again, I would urge people to talk to their physician and get information for themselves on their particular situation, because none of this applies to everyone. It's really an individual basis. But these are the general concepts I want to get across, that you will not necessarily need a pap smear every year. And we do have very good screening tests to detect precancerous lesions that can be treated and then prevent a cancer from ever occurring. And so that's a major success story in the field of cancer in general and the field of gynecology that we're very proud of. The last thing I'll say about that is there's also vaccinations available for human papillomavirus, and that's being recommended in a situation for kids before they become sexually active is when it's most effective. So I would strongly encourage everyone with kids to consider the human papillomavirus vaccination, and even if it's not in a childhood setting and more in an adult setting, it is now approved up to age 45. So it's probably less effective as you get older, because the more times you've had sexual partners, the less likely you are able to now prevent from ever having that infection, but still can be effective. So it's something to think about for everyone.